Okay, so after my last video, I thought that it would be important to get the entire autopsy report for Amanda Rabb. I was very fortunate that a couple of BJ's subscribers contacted me, and through them, I was able to get the autopsy report along with the toxicology report, which I would say in full, except certain things are redacted that, in my opinion, usually are not redacted. It is not uncommon for things to be redacted for privacy reasons, but pretty much the entire internal autopsy of Amanda Rabb, the findings are all redacted. And that's something that I do find to be abnormal and uncommon. I think the best way to do this is just to start at the very first page of what I have and just go through the report page by page with you guys. I do want to reiterate, I got this report from one of BJ's subscribers. I did not directly get it from a Freedom of Information Act request. So I cannot say I have everything. I'd still be waiting for that because I put in a Freedom of Information Act request a week ago and I haven't heard anything back. My purpose for doing this is because I find a lot wrong with this autopsy report, considering what we do know about Amanda Rabb. Even the autopsy and the toxicology report together don't make sense. Again, I will reiterate, I'm not a doctor. I'm not a nurse. I'm not a lawyer. I'm not a coroner. I'm not a medical examiner. But I have looked at several autopsy reports over the last few years, and I have become pretty good at finding inconsistencies, which is all I'm really trying to do here. Good morning, good afternoon, good evening, whatever time it is that you are tuning in. This is Unapologetically me, featuring me. No special guest, just me. Doing a little bit of rebranding here. I've taken some time off. I had to figure out some other forms of income, so I have not been as able to put videos out as consistently as I was before, which I deeply apologize for and I deeply miss. But we will get there. We will get back to that goal of one video a week again, I promise. Obviously, you guys can help me with that by subscribing to the channel because let's just face it, the YouTube algorithm does not necessarily like or push out channels that talk about the truth. If you are new here, welcome. Thank you so much for clicking on this video. I make videos of the more controversial sort in all regards of true crime. Throw in a little bit of these conspiracy theories, if you will. But my main goal is to get to the bottom of things, to kind of steer away from rumors and clickbait and things like that and just get to the truth. Because I do believe in justice, and I do believe in helping victims and their families, and I do believe in giving people a voice when theirs has been silenced. That is my intention for my channel. To all my current subscribers, thank you guys so much for bearing with me over the last few months when I've been kind of going through it. Again, like I said, we're getting back to business here. So thank you again for all of your support. This video is just going to be going through the autopsy report very deeply. We're doing a deep dive on the Amanda Rabb autopsy report. If that sounds interesting to you, then continue watching. The next video will be deep diving into the toxicology report. This ended up taking way longer than I thought it would, and I usually don't make videos longer than 30 minutes. So the fact that these last two videos have been so long, it's not something that I usually do. If you like it, then let me know. But in a case like this, where we really gotta, it happened a long time ago, and I'm really trying to figure everything out. I'm trying to fit as much as I can into each video. So thank you for your patience with that. And without any further ado, let's get on into this first page of the coroner's autopsy report from the Clark County Coroner in Las Vegas, Nevada. We have in the upper left-hand corner, decedent name, Amanda Rabb, location of death, the Desert Hope Treatment Center, room 240, and the date of death being May 9th of 2021. Over on the right side, we have the redaction of date of birth and social security number, which is normal. We do have the age of 25 years old and the time of death being at 11:20 a.m. Moving on, we have the reason for coroner jurisdiction, and that would be undetermined death. That's basically saying, why are we doing an autopsy on this person? Well, because her death is undetermined. She was not sick. She wasn't suffering from anything. Undetermined death, usually that's when an otherwise healthy individual passes away at a young age, but there can also be other reasons that it's undetermined. They right away put not suspicious. Okay, in my opinion, if a death is undetermined, I feel like it already comes off as a little bit suspicious, but I do understand why they say not suspicious. It did not look like any foul play had occurred, and I think that's where they're going with their definition of suspicious. So then we move on to circumstances of death, where it says at 23:55 hours, which would be 11:55 p.m., Amanda was administered her nightly medications, which were listed as hydralazine HCl, losartan, gabapentin, clonidine, and risperidone. On May 9th, 2021, at approximately 0930 or 9:30 a.m., staff found her prone on her bed and unresponsive. Emergency medical services was contacted, and upon arrival, they turned her into a supine position, meaning they rolled her onto her back, and they started cardiopulmonary resuscitation. All life-saving measures were met with negative results, and death was pronounced on 5/9/2021 at 11:20 a.m. So let's make little notes here. According to this summary of investigation, Amanda was last seen alive when she was given her medication at 11:55 p.m. That's almost midnight, and in my opinion, that's pretty late to be giving medication. And the medication that was given to her were listed to be hydralazine, losartan, gabapentin, clonidine, and risperidone. Now, we went over those medications briefly in the last video, or kind of briefly, because let's be honest here, I really don't do anything brief. And we're going to talk about a little bit more when we go over toxicology results in particular. Let's just get through this first page. I just want you guys to kind of mentally take notes of what's being said on this document. It says then, the medical history, which is the decedent was a patient at Desert Hope Treatment Center for cocaine use disorder, severe. She also suffered from schizophrenia and gingival edentulous ridge lesions associated with trauma, which she sustained in a motor vehicle accident in July of 2020.
Yeah, I got hit by a car, but it was set up. They use mathematics and all types of technology.
You hurt your ankle.
To hurt my ankle enough to, hurt it enough.
She was admitted to the facility in October of 2020. I find it really strange that they don't have the exact date listed on this report. I mean, why not? She left the facility on January 25th of 2021 and returned on January 6th of 2021. So she left for a 24-hour period in January. She had recent complaints of left jaw pain, to which the facility allowed her off the premises for a dental appointment on April 14th of 2021, which they had searched her. She did not have any drug paraphernalia that was found on her person or belongings. However, that's like almost a month before her death. So why they even put this on, I don't know. I know I do know. They're leaning towards overdose. That's why. Anyway, let's keep going. The decedent was obese, suffered from hypertension, and here's the kicker, you guys, and was reportedly possibly diabetic. Now, we talked about this autopsy report in very small detail in the last video, and what did I say? Can anyone remember what I said? Or what I thought about her lab reports? I made a comment that her levels for certain things indicated that she may have been diabetic and that she wasn't being treated for her diabetes because there are no medications that she was taking for diabetes. So essentially, Amanda Rabb is at a medical facility. There are medical doctors there. Amanda was there for 7 to 8 months and they don't know if she was diabetic or not. Let's move on. The decedent's medications were administered by Desert Hope Treatment Center staff. The medications were not impounded. However, a medication administration list was collected. What that means is they didn't seize the bottles of medication to know for certain what she was taking. They just took their word for it. And that's probably because it's a rehab center. So they're not getting a whole pill bottle full of meds. They're being given their meds when they're supposed to take them. So there really is no way to know 100% what any of the patients are being given unless if it's written down. And, things can be written down wrong, but okay, here I go trailing off again. Now we're going to get into the scene. As you can see, there is a sentence redacted here. It's interesting to me that they redact certain things, but yet in other places on this report, the information is freely available. I'm assuming that the address of the establishment went here, along with her room number being redacted. But up at the top, we have the room number. And so we know where this happened. So I don't understand what may have been written there. But we're not going to waste time on stupid stuff right now. So let's move on. Unless if it turns out to be important later, because you never know. We're just going to make a little note of that. She lived in room redacted, where I observed her. You know what? Maybe that wasn't her room. Maybe a different number. I don't know. All right, I'm reading too much into this. Let's just continue. I don't know why they redacted her room down there, but they didn't redact it up at the top, but okay. I observed her lying supine on the bed. Next to her was a pillow. I'm assuming that's supposed to say with bloody purge on it. The room was unorganized with clothing on the floor and lying on top of the dresser. Loose cigarettes were observed on the nightstand. A glucometer was observed on the dresser, and there were numerous candy wrappers and sodas observed throughout the room. Packets of cigarettes were observed in the room. I observed no evidence of alcohol or illicit drug use in the room, and no signs of foul play were observed. Okay, let's just break that down. Now, I'm to understand that this scene is being reported by the first officer on the scene. So basically, when he gets to the room, he sees that the pillow next to her had some bloody purge on it. There are candy wrappers, sodas observed throughout the room, which indicates to me that Amanda had consumed a very large amount of sugar recently. There's packets of cigarettes observed, loose cigarettes, which is fine. We know she had nicotine in her system, that cotinine. She admits in one of her videos they go out to the smoking area and to smoke a cigarette. So
I'm so glad you guys are here so I can show you basically what I do here. So here's the volleyball court. We play volleyball, and we also have like a big speaker where I DJ the music, so it's so fun. And over there is the smoking pit. This is where we smoke at. You can smoke there 24 hours.
We know she smokes cigarettes. That's not the issue here. To me, what's a little bit more alarming is the candy wrappers and sodas that were found in addition to the glucometer. At the same time that we know that they are saying she was reportedly possibly diabetic, yet she was obviously checking her glucose levels, and there were numerous candy wrappers and soda observed throughout the room. So that's a bit interesting to me, because I gotta question why someone with possible diabetes would eat a ton of candy and soda. Right? That's interesting. I'm not going to say what I think about it or anything yet. I'm just saying it's just weird. We're going to break all that down after we go through all of these reports. Okay, so probably in a separate video. So moving on to the next page, I'm just going to put a little trigger warning here. I mean, you're on a true crime channel. You're likely going to hear things. I mean, I did title this Autopsy Results. For those who think that I might be gentle with how I deliver an autopsy report, you're thinking wrong, because I'm not. I will read exactly what is on the autopsy report, unlike someone else we know. Okay. Body. The decedent was that of a 25-year-old Black American female lying supine on her bed. She was clad in a black shirt and bottoms. She was obese. A head-to-toe body examination revealed no crepitus, wounds, or obvious masses. Foam was observed emanating from her mouth, along with a red-colored purge emanating from her nares and mouth. So, there was foam and a red-colored purge emanating from her nose and mouth. Her neck was free of ligatures or marks. No defensive marks or wounds were apparent. Lividity was blanching anteriorly, consistent with the position found. Rigor mortis had passed. No signs of life were present. Now, let's break this down. Right away, they're explaining that there is no evidence of foul play, right? They're saying that there were no wounds or any signs that she had been attacked. They're saying that her neck was free of ligatures or marks, meaning she hadn't taken her own life by hanging, which we'll get into. not with her, but with Desert Hope Treatment Center, because they have had a couple of people take their own lives by hanging in their facility in years prior. So I think they really wanted to be sure that that was definitely ruled out immediately. Now, we can talk about the purge and the foam in a little bit, but right now I want to address the lividity, which was blanching anteriorly, which means that the lividity had settled on her front side, which is consistent with the fact that she was initially found prone on her bed by the nurse, meaning she was found lying face down. Lividity usually begins 30 minutes to 4 hours after death and is most pronounced 12 hours after death. Blanching, or a whitish discoloration that results when pressure is applied to the skin, can occur up to 8 to 12 hours after death. After this time period, however, the blood becomes fixed or non-blanchable. However, they go on to say that rigor mortis has passed and that no signs of life were present. Let's go even further here. Lividity is also called livor mortis. That is the settling of blood in the body due to gravity. Livor mortis usually develops between 2 to 4 hours after death and becomes non-fixed or blanchable up to 8 to 12 hours after death, and fixed or non-blanchable after 8 to 12 hours from the time of death. I'm just going to show you again, and trigger warning, I'm going to show you a photo of what blanching looks like, just so you can get a visual. Now you can feel free just to scroll ahead about 5 seconds. That's how long I usually put a visual up for. It's not graphic, but I'm just warning you. Like, you're not going to see anything nasty. It's just a mark on some skin. This pooling of blood is a physical process based on the loss of blood pressure when the heart stops beating, and will therefore occur at the same rate whether the temperature is cold or not. So it is less susceptible to the atmosphere. Livor mortis does not have very precise measurements of the time of death after 12 hours, however. Rigor mortis generally disappears 36 hours after death, followed by a phase known as secondary flaccidity. The past stage of rigor mortis means that the muscles are in the process of becoming flexible again, okay? So when someone says rigor mortis has passed, that means they have already gone through complete rigor and their body is able, their muscles are starting to be able to be movable again. So I found this to be a bit interesting that they noted that rigor had passed, because to me, this would indicate that Amanda had been dead for quite some time. Let me elaborate. Immediately after death, all the muscles in the body relax. Then very slowly, over the next 24 to 48 hours, the body starts to stiffen due to a buildup of acid in the muscle tissues. In general, if the body feels warm and no rigor is present, death occurred under 3 hours before. If the body feels warm and stiff, death occurred 3 to 8 hours earlier. If the body feels cold and stiff, death occurred 8 to 36 hours earlier. If the body is cold and not stiff, death occurred more than 36 hours earlier. Does anyone see a problem with this? I'm telling you, get out a notebook, you need to take notes. So something that is missing from this report is the body temperature. Now, it doesn't have to be exactly what her body temperature was by actually using a thermometer, but typically they would say whether the body is warm, cool, cold, whether it has stiffened by rigor or not. We don't have a temperature of the body. However, they are saying that lividity was blanching, but that rigor mortis had passed. So she was no longer stiff, or she was starting to not be stiff, yet lividity was blanching. All right. We're going to get into that later. I don't know. So as not to just harp on one thing, because there's a lot to go through here. So rigor mortis was not mentioned, which is the cooling of the body after death. Typically after death, the body drops approximately 1.5 degrees for each hour after death. Also occurring around the same time is the filming over the eyes. Investigators at a scene can look into the eyes to make an approximate time of death based on the cloudiness that is seen in the eyes. And we kind of talked about that earlier with the findings. Now, I'm not surprised that they didn't check this. This was never considered suspicious. I think at the beginning they assumed that she had overdosed, so they really didn't look into anything else. However, Time of death is important, and I don't understand why it wasn't recorded whether or not her body was warm or cold. I'm assuming it was cold because they did say rigor had passed. So why not say that? If any of you are wondering why this is so important for me to figure out, like in general, it's because if rigor has passed, that means that Amanda has been dead for closer to a full day, as in more than 12 hours. And either way, if we look at not her actual time of death that was reported at 11:20 a.m., which would be approximately close to 12 hours after she was last seen alive, we have to remember, no, she had already passed away before 9:30 a.m. That's what the nurse said, right? That's when 911 was called. And we'll get more into the approximate times of that as well. Timelines are extremely important. I mean, if you can't make a timeline make sense, something is wrong. If Amanda passed away even 8 hours prior to 9:30 a.m., that means she passed away almost immediately following taking those medications. And I think that's something to note. This report does not say that rigor has not begun yet. It says that rigor has passed, meaning her body was in rigor and now is past that stage, meaning she could have been dead for 24 hours, maybe even 36. This description of the body doesn't add up. Lividity was blanching, yet rigor had passed, and no signs of life were present. That does not make sense. You can't have lividity still blanching, but rigor mortis already have passed, unless rigor was interrupted, but that's a whole nother ballgame. And right now, I just want to get through this autopsy report. We may or may not revisit this. And again, I just want to reiterate why I'm doing this. Amanda Rabb lost her voice a long time before she passed. 8 months before she passed. Once she was put in jail for assaulting Larry Rabb, her father. Her voice was taken from her. Now her voice has permanently been silenced. We will never know the truth. We only have what we've been told by other people. But one concrete thing that we do have is this autopsy report. And while I don't believe this is the full autopsy report and many important things have been redacted, that alone is suspicious. That alone deserves someone looking into. I'm going to be Amanda's voice today on my platform of Unapologetically Me True Crime because Amanda Rabb deserves a voice. I may not be able to answer all the questions. In fact, I can't answer all the questions, but this is suspicious and in my opinion needs to be looked into by someone who does know what they're doing, not me. So maybe the more people that talk about this, the more we can get people behind this. Desert Hope Treatment Center needs to be looked into, period. Let's move on. So it then goes on to say property of personal effects and that no property was impounded. So that just means they never took anything from her room as any kind of evidence or anything like that. Then it says forensic issues and reason for seal, which I've looked at a couple of Clark County, Nevada autopsy reports and they all say that. So that's just a normal phrasing term that they use for why they are investigating. It says no obvious trauma, history of cocaine use, no obvious paraphernalia found in the deceased's room. However, is allowed off campus, which means Amanda was allowed to come and go, which they're kind of alluding that she was allowed off campus. So she could have gotten some drugs. And then it says foam cone was present. Limited medical records were obtained. Now, let's break that down a little bit more. What this report is saying is that there was no obvious trauma, which they likened it to no foul play or no self-harm, as in unaliving. They noted a history of cocaine use. Obviously, she was in rehab for cocaine use disorder, severe. However, there was no paraphernalia found in her bedroom, but they noted that she is allowed to go off campus, which means she could essentially go and get drugs if she wanted. And then they note that a foam cone was present. This basically all goes along with what appears to be the theory they had at the time that Amanda overdosed, that she had relapsed and she had passed away from that relapse. A foam cone is normally found around the nose and mouth of someone who has overdosed from opioids. There are other reasons a foam cone would be present, such as pulmonary edema. So it doesn't necessarily mean overdose, but it is commonly found, or should I say almost always found, in an opioid overdose. So being that she was in rehab, I really feel like, and this is just my opinion, they were like, she relapsed, she left campus, she got some kind of pills or drugs and she took them. That's it. I really don't think they thought much of it. They, meaning EMS nor the police. They also put the limited medical records were obtained. And again, I find that a little interesting because I don't know. I mean, I don't know if I want to call it suspicious, but it is a bit interesting that Amanda was at that treatment center for months upon months before she passed away, and they only had limited medical records as if she couldn't have informed them of everything. I don't know. Some other things that could cause that foam cone would be tonic-clonic seizures. That might be setting off alarm bells for some people, as well as epilepsy. And I mentioned pulmonary edema from congestive heart failure. I did note that they wrote on the first page how Amanda had complained of left jaw pain, which can sometimes be indicative, especially in females, of a heart attack. However, they stated that they sent her to the dentist, and that was a month prior, leading me to believe that they really were under the impression that it was a tooth issue. There's no mention of what happened at the dentist, what the dentist said, if it were in fact a tooth. Again, we don't have any of that because, as they even stated, we only have a limited medical record. The witnesses and information sources listed were the officer on scene and the LPN that found her. The LPN that found her is Roberta Kahn, and this is her. And then we go into the narrative, which states that on May 9th, 2021, at 10:40 a.m., dispatcher D. Ford reported the decedent's death to the Clark County Office of the Coroner Medical Examiner, saying, "I responded to the provided address and arrived at 11:15 a.m. So the death was reported at 10:40 a.m. and the second officer on scene responded to the address at 11:15 a.m. Upon arrival, I was met with Officer Gordon, who provided the event number. He had no additional information. None. First officer on scene had absolutely no information other than that there's a dead woman here. Okay. He goes on to say, I then met with Roberta Kahn, LPN, with Desert Hope Treatment Center. She provided the aforementioned circumstance and information detailed in the medical history. Heights Funeral Service was contacted per rotation. Mortuary attendants arrived to make removal. The decedent was wrapped in a white sheet, placed in a body bag, and released for transport. Now, we're going to move on to the pathologic exam of the body of Amanda Rabb and the final pathological findings. And this is dated May 10th of 2021, so the very next day, where it says no evidence of traumatic injury. It also states the toxicology, which is peripheral blood positive for gabapentin, 14 mcg, cotinine, and caffeine. So I have a question, first and foremost. Where are the other drugs? If peripheral blood was only positive for gabapentin, cotinine, and caffeine, the cotinine we talked about in other videos, and this one too, nicotine. So caffeine and nicotine and gabapentin, 14 mcgs. The vitreous electrolytes were creatinine, 1.4, sodium, 120, potassium, 19, chloride, 120, and urea nitrogen, 12 milligrams. I kind of broke that down in the last video, but let's break it down again, in case you missed it. We're also going to go a bit deeper here. Let's talk about the gabapentin first. The amount that's listed to have been found in her system is 14 micrograms. You guys, I have looked this up and up and up again. I have spent hours on several different occasions trying to find this to make sense of it. Every single time, no matter what search engine I use, it comes up as a dosage for a small dog or a cat. The standard gabapentin dosage for adults is 300 to 600 milligrams, taken 3 times per day. Amanda Rabb had 14 micrograms at the time of her death, which looks to me as though she barely had any. She had what they would normally give a small dog or a cat. Like it wasn't being taken on a regular basis, or her dosage was super duper small. That, or she hadn't been taking it recently at all. Like I said, I've tried to really look into this. I'm not making any sense of it. I can't make sense of it. So if anybody is like a nurse or anything that knows anything about this, please either email me, leave a comment below, because I don't want to get this wrong. It's important to me. So if I'm wrong, and I feel like I am, because this just doesn't make sense, please let me know. Let's move on to her electrolytes, because I mentioned in the last video that it seemed to me that based off of her numbers, she was in an extreme electrolyte imbalance or even crisis at the time of her passing. But let's look at it again. Her creatinine levels were 1.4 micrograms. A normal creatinine level in an adult woman is 0.6 to 1.1 milligrams. It's kind of weird, because this again was done in micrograms. So I end up having to do like math to figure out whether or not the results are normal, because it only really tells you in milligrams when you search it. So you have to really look to figure this stuff out. But let's talk about what creatinine is really quickly, so we even know why any of this is concerning. Creatinine is a chemical waste product of creatine. Creatine is a chemical made by the body and is used to supply energy, mainly to muscles. Your creatinine levels would be tested basically to see how well your kidneys are working. Creatinine is removed from the body entirely by the kidneys. So, if the kidney function is not normal, the creatinine level in your blood will increase. And this is because less creatinine is excreted through your urine. So it begins to build up. Women will often have a lower creatinine level than men, and this is because women often have less muscle mass than men, but creatinine levels do vary based on a person's size and their muscle mass. So we got to keep that in mind as well. A higher than normal level may be due to a blocked urinary tract, a kidney problem such as kidney damage or failure, infection, or reduced blood flow, dehydration. There are many other conditions where this test could be ordered, such as high blood pressure, diabetes, and medicine overdose. Amanda's level of creatinine is 1.4 micrograms, which equal to 0.0014 milligrams. How does this even make sense? Does this make sense to you? Did they mean milligrams and not micrograms? They have micrograms here, 1.4 micrograms. Well, with micrograms, you just divide by 1,000 to get what it would be in milligrams. So this is what I got, 0.0014. Either this is a mistake and a pretty big one, or Amanda essentially had no creatinine in her system at the time of her death, because there's very minuscule amounts. Now, if they meant milligrams, there's still an issue here, because normal creatinine levels in adult women is 0.6 to 1.1. And I would likely tend to think that they meant milligrams, and her creatinine level was 1.4 milligrams, not micrograms, as they stated. If that's the case, then that was extremely high, and again, there's still a problem here. And this would go a lot more along with my theory. So let's move on. Now let's look at the sodium level of 120 millimoles. That's what mmol stands for. Now this I talked about in my last video. I found that a sodium level of 120 millimoles per liter is known as a severe case of hyponatremia. This sodium level can significantly affect your body's normal functioning, leading to potentially life-threatening symptoms. So according to these levels, Amanda had a severe case of hyponatremia, or very low sodium. Now, let's look at the potassium. Normal potassium levels are 3.6 to 5.2 millimoles per liter. Amanda's was 19 millimoles per liter. 19, you guys! 3.6 to 5.2 is normal. Amanda's was 19. High potassium is also known as hyperkalemia. which is the medical term that describes the potassium level in your blood that is higher than normal. Potassium is a chemical that is critical to the function of nerve and muscle cells, including the ones in your heart. Your blood potassium level is normally 3.6 to 5.2 millimoles per liter. Having a blood potassium level higher than 6 millimoles per liter can be dangerous and usually requires immediate treatment. And again, I will be redundant when I say, and Amanda's was 19 millimoles per liter. So according to these levels, Amanda had a severe case of hyperkalemia, one that certainly could have killed her. Let's look at her chloride, which was 120 millimoles per liter. Normal levels of chloride for adults are in the 98 to 107 range. If your test shows a chloride level higher than 107, then you have hyperchloremia, an excess of chloride in your blood. And this can be very dangerous because of the link to higher than normal acid in the blood. If it isn't treated promptly, it can lead to kidney stones, hampered ability to recover if you have kidney injuries, kidney failure, heart problems, muscle problems, bone problems, coma, and death. Last but not least, here we're looking at the urea nitrogen, which was 12 milligrams. Normal urea nitrogen in general is around 6 to 24 milligrams, but normal ranges can vary depending on the reference range used by the lab and the age of the person, things like that. So it appears that Amanda's urea nitrogen was the only thing so far that's in the normal range. So let's move on to additional findings. Obesity, obviously, history of schizophrenia, and hypertension. Now, I'm still kind of trying to understand the schizophrenia diagnosis because Lima did say in several of her interviews that they were going to have her retested for that. She also said in another interview, which I want to say it was on No Jumper. I'm obviously going to find it and I'm going to insert it here for you guys. But she did admit that Amanda did not have schizophrenia, that it was drug-induced schizophrenia.
And the first facility that she went to said that because Amanda had previously only been in facilities for like a couple days and then released, so she'd get in there high, she'd be talking to herself, and they'd be like, oh, schizophrenic. And so when she was in a facility for a longer period of time, they were like, they reached out and said, like, Amanda doesn't have schizophrenia, that was drug-induced.
So then why was she being treated for schizophrenia according to the staff of Desert Hope Treatment Center? Because according to Desert Hope Treatment Center, Amanda was administered hydralazine, losartan, clonidine, risperidone, as well as gabapentin. That's the anti-seizure medication. Some of those are hypertension medications, but risperidone is schizophrenia medication. So we don't have any medications for diabetes. The gabapentin level is either not written correctly in here, and it's actually supposed to be milligrams, or barely even found any in her system, which means she wasn't given gabapentin the night before she was found dead. She wasn't given anything the night before she was found dead. So what would these nurses be talking about? That the last time she was seen alive was at 11:55 p.m. when her medications were administered. Where are they on this tox report? They're completely wiped off. This doesn't make sense. And then we go on to the opinion of the coroner. And that is that the cause of death is cardiac arrhythmia. And that hypertension, obesity, and schizophrenia were contributing factors. Yet, right above this statement is her toxicology, which doesn't have any medications for schizophrenia listed, nor for hypertension. And it also lists very severe hyponatremia, severe hyperkalemia, and severe hyperchloremia. But no mention of diabetes. The only mention of diabetes we hear is back on page 1 from the first officer of the summary of investigation, where it says that the decedent was obese, suffered from hypertension, and was reportedly, possibly diabetic. We also know that a glucometer was observed on the dresser of Amanda's bedroom. and that there were numerous candy wrappers and sodas observed throughout the room. So whether or not she was possibly diabetic, these things cannot be ignored when put together. And then they go on to the manner of death, and they say, based on the investigative and autopsy findings, the manner of death is classified as natural. Now, I don't know who this pathologist is. I'm obviously going to have to look more into him, but something ain't right here. Then we flip to the next page where it says post-mortem examination on the body of Amanda Rabb. It goes on to say the examination commences at 8:15 a.m. on May 10th, 2021. Identification. At the time of autopsy, the body is identified by a Clark County Office of the Coroner or Medical Examiner by a toe tag inscribed with the case number and the name Amanda Rabb. External examination states that the body is that of a well-developed, well-nourished Black female. The body is clad in the Black clothing listed below. The body measures 66 inches in length, which is 5'6", and weighs 227 pounds and appears to be compatible with the reported age, which we know is 25. Injuries are described in the section Evidence of Injury, and medical therapy is described in the section Medical Intervention. The body is cold, okay? Now this is the next day, all right? And in the medical examiner's office, so I would hope that it's cold, but he did write that it's cold, and rigor is present and resolving. All right, a whole ass day after she was found, with rigor having been passed, now rigor is present and resolving. Lividity is present and fixed on the posterior surface of the body, except in areas exposed to pressure. Now this is interesting. I almost feel crazy when I talk about certain things, and not just in this case, and in other cases too. I start to feel just nuts. Like my brain must be making things up, because am I really reading this right? Would they really make a mistake like this on an autopsy report? Would they really make any of these mistakes on an autopsy report? Because it seems like there are a few. I definitely believe that when the coroner got the body was cold and rigor was present and resolving. Lividity is present and fixed. That means it's no longer blanchable, like we discussed earlier, which does coincide with rigor resolving. And this also says on the posterior surface of the body. So that would be her back. Now remember, they flipped her over on her back, and that's probably where she remained. I mean, I can be sure of it. That's once they flipped her over on her back, she remained on her back. So what about the lividity that was noted to be anterior when she was found? There's no mention here that they're posteriorly. What about anteriorly? Because there was allegedly lividity blanching still the day before, yet rigor had passed. I don't get that. Now rigor is present and resolving, and lividity is present and fixed on the posterior surface of the body. What happened to the lividity that was there? Does it just go away? Maybe I have to look this up, but let's move on. Either way, that's a little bit different than what was initially written. This examination was done at 8:15 a.m. on May 10th. This time it says that rigor is present and resolving. So maybe they made a mistake and rigor hadn't even begun yet. But why would they write that? And we don't even know, because they never said whether or not the body was warm or cold, because the body is still warm when rigor begins. It also says here lividity is present and fixed on the posterior surface of the body, except in areas exposed to pressure. This is odd, because it says lividity is present and fixed on the posterior surface of the body, which would be the back, whereas back on page 165, it says that lividity was blanching anteriorly, consistent with position found, which would be on her stomach. Was she found on her back or was she found on her stomach? Because this autopsy report is inconsistent AF, to say the least. Let's keep going. It goes on to say the head is normocephalic and the scalp hair is black, curly, and up to 2.5 inches in length. Facial hair consists of sparse chin hair, the Irides. I'm sure I'm going to get a bunch of shit in the comment section from the pronunciation police about how I'm pronouncing things, but I'm doing the best I can for a purpose bigger than my pronunciation of words, okay? The cornea are cloudy. The conjunctivae are congested and without petechiae. The sclera are congested and without petechiae. The ears are normally formed and set. The external auditory canals are clear and both earlobes are pierced. The nasal skeleton and maxilla are palpably intact. The external nares and mouth contain red-brown purge fluid. The lips are without evident injury. The teeth are natural and in good condition with multiple teeth absent. There is increased suffusion of the head and neck. The chest is unremarkable with no external evidence to injury to the ribs and sternum. The abdomen is protuberant. The posterior torso is unremarkable. And it goes on to describe the genitalia, which has been redacted, I'm assuming for privacy reasons. The extremities show no evidence of fractures, lacerations, or deformities. The fingernails are intact. The fingers have been previously fingerprinted. Okay, so when they talk about the corneas and the eyes being cloudy and congested, that's normal. When they say without petechiae, that means that petechiae is normally seen when someone is strangled or their air supply has been cut off in some way. So there not being any petechiae means that she did not die by suffocation, manually or otherwise. I did look into the increased suffusion of head and neck because I didn't really understand why that was there, and a lot of stuff came up. But because I'm not a doctor and I'm not a coroner, I'm not any of these things, and I'm just not even going to speak on that right now because I couldn't find anything concrete about that. If you know and you want to drop down in the comment section what that means, increased suffusion of the head and neck, because when I looked it up, it never led to anything good. But at the same time, it didn't make any sense for Amanda. So if anyone wants to let me know about that, otherwise we'll move on. So then it just goes on to say the clothing she was wearing, that there's no evidence of acute medical or surgical intervention. Her x-rays are basically unremarkable. There's nothing to say anything traumatic happened to her. And then it goes into identifying marks and scars, tattoos. The only thing I found interesting about that is she had a scar on her abdomen that seems to be a surgical scar. Yet they say no surgeries have been evident. So I don't know. As far as pages, I have pages 164, 165, 166, 167. I just went over page 168. The two pages, page 169 and 170, are mostly redacted. 170 containing the internal examination of Amanda Rabb. And this just seems off to me. It's interesting too because Nevada seems to be one of the few states that still kind of locks down their autopsy reports. I just would really like to know why that's redacted. I find it really interesting because what could possibly be written here that is a privacy issue or a problem when it comes to musculoskeletal system and the genitalia? Like, I don't know. I've seen multiple autopsy reports and they've never blocked this stuff out. They block out other stuff. It's really odd to me what is redacted because it's something that really shouldn't be unless it's pointing to something they don't want you to know. I mean, obviously, right? Most states don't do this unless there's a criminal investigation that's going on. But somebody went to the courthouse and asked for these things to be redacted and used privacy as a reason. Let's keep going. The musculoskeletal system is redacted for whatever reason. I don't know. Microscopic examinations, selected portions of organs are retained in formalin with preparation of histological slides. No postmortem sickling of red blood cell is identified. Then it lists the slides with the lungs being unremarkable. Slide 6 would be of the kidney, and they noted tubular autolysis, but then they also noted unremarkable. Now, tubular autolysis can be a sign of a renal disorder known as acute tubular necrosis. However, the fact that they wrote unremarkable next to it makes me think that this was not the case, because tubular autolysis is when there's not enough oxygen And obviously, when a body is no longer consuming oxygen because they have passed away, this is going to happen. And I think, and I'm hoping, that they check to see if it's to the point of acute tubular necrosis, and they found that it was not. However, it's just interesting to me because acute tubular necrosis is a renal disorder, and the warning signs of this, just based on labs, would be elevated creatinine, low sodium, and metabolic acidosis, or hyperkalemia. So, it's interesting to me. Now, I pointed out that there was suffusion between the head and neck that they did write down. And what I also found interesting is that both the internal examinations of the head and neck have both been redacted. So that would have given me a little bit of a clearer picture on whether or not this suffusion was an issue or not. Was it normal? Is it something all bodies go through? I don't know, because the autopsy report is so heavily redacted, I can't see whether or not I'm making a mountain out of a molehill or not. So I have no idea whether or not this suffusion was an issue or not, or indicative of anything that they're not telling us, because it's redacted. The body cavity is in full. The ribs, sternum, and vertebral bodies are visibly and palpably intact. No adhesions or excess fluid are in any of the body cavities. The organs occupy their usual anatomic position. Then we see head or central nervous system completely redacted, neck completely redacted. Cardiovascular system is here, where it says the heart is contained in an intact pericardial sac. The epicardial surface is smooth. The coronary arteries are present in a normal distribution and are widely patent. The myocardium is firm and homogeneous. The valve leaflets are thin and mobile. The walls of the left interventricular septum and right ventricle are 1.2, and 0.4 centimeters thick, respectively. The endocardium is smooth and glistening. The aorta gives rise to 3 intact and patent arch vessels. The renal and mesenteric vessels are unremarkable. The vena cava and major tributaries return to the heart in the usual distribution and are free of thrombi. The heart weighs 300 grams. Okay, so because they put down cardiac arrhythmia as her cause of death, let's just go a little bit deeper on this. What does all of this mean? Is any of this a red flag? Looking at this cardiology report, did Amanda Rabb have an underlying heart condition or any precursor that would indicate she might be subject to a sudden cardiac arrhythmia? Well, we do know that she had hypertension, and that alone can be a precursor to sudden cardiac death. Not so much if it's being treated, however, but there's still a chance, right? But looking at this, the report about her heart, in short, no. Amanda Rabb's heart was of normal size and function. Looking at the measurements of her left and right ventricles is where I get confused. I mean, looking at other autopsy reports of ventricles, it seems that Amanda's may have been on the more narrow side. I do find it odd that it states that her left and right ventricle were 1.2, 0.4 respectively, meaning that both of them were exactly the same size. From what I've understood when I've looked this up, is that the left ventricle tends to be a little bit wider than the right. Maybe I have that confused, but again, I'm not a medical professional, so please let me know if I have that wrong, and if not, just take it with a grain of salt. But from what I can see here, it doesn't look like she had congestive heart failure or anything like that. But again, not a medical professional, okay? Unfortunately, without being able to see the other pathology findings of the other organs, I can't even make any kind of uneducated conclusion. And I say uneducated conclusion because this is just my opinion, and I'm nowhere near qualified to make any sort of conclusion about this. But I think we all know you don't necessarily need to be a licensed medical professional to notice inconsistencies and to use Google or a medical search engine to find out what is normal and what is not normal when it comes to the human body in autopsy results. Again, someone went to the court and had these specific portions of the autopsy redacted. And I know we're still going through the autopsy report, but when we get to the toxicology report, I think I may have found out why. So I'm just going to be annoying and throw it out there to you that if you're not subscribed, please subscribe, hit that notification bell so that you don't miss any of the other videos about this case or any other cases to come, because I really do feel like I found some answers. All right, moving on. Page 169 is the internal examination. The head and neck are both redacted. Page 170, it's been fully redacted. It only has the cardiovascular system in full, but the respiratory system, hepatobiliary system, gastrointestinal tract, urinary system, endocrine system, they've all been redacted. Why? If there is nothing to hide, we would see it in these explanations, but they've all been redacted. They left the cardiovascular system in the body cavity, but that's it.
That's suspicious.
I mean, I gotta get suspicious when damn near 95% of the autopsy is redacted.
That's weird.
Right? I mean, tell me I'm wrong here and I'll stop. All right, that's it right now for the autopsy. I just wanted to go over all of it, say my opinion on it. Next, we're going to go into the full toxicology report on its own. I'm just going to make a separate video for that because this has gotten to be a lot longer than I intended for it to be. If you guys have any questions, comments, if you know something, if I was wrong about something, any of that, please feel free to put it in the comment section down below. I have no problem with being told I'm wrong about something. It's better that people know the facts. That's the whole point of my channel, is to get to the truth. So if you want to correct me, do not think that you're insulting me or that I think that you're insulting me unless you actually are insulting me. And I think we can all tell the difference when we're being insulted. Also, the pronunciation police, I don't need to be told how to say medical terms. It's just not super crazy important to me that I get the terms right. I'm putting them on the screen so that you know what I'm talking about, but I'm sure I'll get that anyway. I will see you guys on the next one. We're going to go over the public report, the toxicology report. We're going to go over the public police report, which is like nothing. I kind of want to put in some requests for certain things. The thing is, a lot of times they cost like $25. Like, yeah, it's the public can know, but you got to pay money to get it. And I'm not not capable of doing that right now. So if anyone wants to help out with any of that, like, you don't have to give me the money. You can just go order them. They're $25. I'd like to know the, you know what? We'll get into this in the next video. So we're probably going to blend the public report with the toxicology report because they're pretty short. Again, there's just too many questions here that aren't being answered. And that's what I think people don't understand when they want to right away jump to, you're a conspiracy theorist. No. Okay. I'm asking questions that should have answers that make sense. I'm not going off on some wild tangent that aliens came down and took over the mind of Lima and made her do all these crazy things, brain control and all this craziness. No. I'm saying, why does this autopsy report not make sense? Why does it look like Amanda Rabb died from a diabetic crisis, yet diabetes is not mentioned at all? And I have several more questions, and I know you guys do too. So I will see you on the next one where we go over the rest of these reports. Please be happy, be healthy, be safe, and always be unapologetically you. Bye-bye.